Hey, good morning. My name is Valentine and I'm here to do a head to toe assessment. May I confirm your name and date of birth? Let me use your wristband. Confirm your name and date of birth.
My name is Mary Kimungu. I was born on July 1st, 1966.
That tallies with my record. So I'll perform hand hygiene and don clean gloves. And as I got into the door, I was assessing to see my client's orientation, whether she can see me, she can establish that I got into the room. So then I'll go ahead and after confirming her name and date of birth, I will go ahead and start my assessment. So Miss Mary, the reason for your assessment today is because you had a procedure done on your tooth last week, and the physician want to confirm or to check on how you're doing. How is your tooth? Did you experience any pain?
No pain.
How about discomfort?
No.
Any drainage?
No.
Okay, then I'll go ahead then and start by taking your vitals, and I'll do your temperature, your blood pressure, your heart rate. I'll do your respiration. I'll do the temperature, and I'll do the SpO2, and I will document that I did those. Then after that, I will go ahead and take her height. Miss Mary, I'm gonna take your height and your weight. Then I'll go ahead and start assessing her by the head. I'll make sure that her head is well rounded and asymmetrical. I will inspect the scalp to make sure that there is no hair loss. I will also inspect, palpate to see whether there are any bumps on the head. And I haven't noticed anything. And I'll also inspect to see whether there is any infestation of like mice and stuff like that. So the head looks okay. So I'll then go ahead and inspect her eyes. And I will start by trying to see whether there are any drainage. I will inspect the iris, the sclera, and the conjunctiva. I'll also inspect the pupil to see that her eyes are nice and healthy, and she's looking quite okay. So I'll then go ahead and make sure that her eyelid is not drooping, and I will use Miss Mary. Can you move with my pen as I move? Just move your eyes. I'm just trying to make sure that her pupils are equal. They are all rounded and they are accommodating the movement. Then Miss Mary, I'm gonna go ahead and go to your ears. I'll inspect the ears for any redness or any drainage, and I'll then go ahead and move the triggers to be able to palpate the mustard process. And I'm done with the ears. I'll go ahead and inspect the nose, inspect the sneers, make sure there's no drainage and the integrity of the skin on the sneers. Miss Mary, can you occlude one of your nose and blow with the other one to see? Let's do with the other side. It's all nice and clear. So then I'll go ahead to your mouth. I'll inspect the mouth to make sure that the lips are nice and pink. And she doesn't seem like she's dehydrated. She seems quite okay. So Miss Mary, I'm gonna go ahead and inspect your mouth. If you can say, open your mouth. No, open your mouth. I wanna inspect the gum, the cheeks, and the buccal. I'll also inspect the teeth to see that there are no broken teeth, there's no cavity, and to make sure that there's no infection on the tooth that was extracted. Then I'll go ahead and ask Miss Mary, can you say to inspect her? And I can see her vulva at the end, which is midline, and yeah. So I'll go ahead and go to the neck. Miss Mary, I'll palpate the carotid artery each at a time, and I'll go ahead and ask Miss Mary to bend your knees up and down, side by side. So Miss Mary, can you turn 45 degrees and then bend your neck? I'm just trying to see whether she has any distended jugular veins. Let's move on there, turn on the other side, and she looks quite okay to me. Then I'll go ahead and inspect her throat to make sure that her trach is on midline, and palpate to maybe inspect and palpate to see whether there are whether it's swollen or any bumps, and the skin integrity looks good to me. There's no any abnormality. I'll then go ahead and listen to the carotid using the bell side. Okay, so then I'll go ahead and go down to her arms. I'm gonna inspect her nails, and I'm gonna be inspecting her her skin. I will then go ahead and inspect her chest to see whether there is any abnormalities, and at that point I will be able to to do a cardiovascular and respiratory check. I will do a 1 minute epical pulse to make sure that there's no murmur or anything. I'll do a cardiovascular point check to try to identify her S1 and S2 and any other sounds, and I'll be using the diaphragm to do that. So I'll go ahead and do that. Miss Mary, let's do that. Sounds normal, and I'll then go ahead and do respiratory check, which I already did. Then I'll go ahead and do a GI check. So Miss Mary, I want you to lie down on your bed, and I will inspect the stomach and the chest. I'll also palpate all the 4 quadrants of the stomach to make sure that there's a bowel movement. If there's no bowel movement, I will wait, and I will do that. I will wait for 5 minutes to do it again. I'll be looking for any pain, tenderness, any masses, any obstruction, and she seems to be okay. Miss Mary, when is the last time you had a bowel movement?
This morning.
Do you have any problem with passing urine? Any pain?
No.
Okay. So she. And maybe one last question: do you get your monthly periods?
No.
Okay, so then I'll go ahead then and inspect the feet, and I will be looking for the pores in the feet. I will be looking for any masses. I'll be looking for any swelling, and I'll also be looking for any swelling by asymmetrical or bilateral. I'll also be looking at to see whether she has any edema on both feet. I will palpate the distal, do distal pulse to make sure that she's okay. I'll then go ahead and do that, and don't know whether you can see. Yeah, it looks good. The nails looks okay. And she's strong. So then I'll go ahead and inspect her back. I will start by the head, make sure there are no masses at the back. I'll also inspect the shoulders on the back, the skin integrity. I will do a spine check to see that her spine is symmetrical with no concerns at all. I will check whether she has any wounds on the back, like pressure ulcers or something like that. I will then come back and do maybe a neuro check. So Miss Mary, can you straighten your hands like this? Try to pull me down, and try to, okay. Then when you're holding your arm, I will try to push you up. Try to pull me down. Okay, let's do this on the head. Then on your feet, I want to see how far you can go. Okay. And then I will, what else have I done? Miss Mary, do you have any question for me?
No.
No question.
Mm-hmm.
Okay. And you said you don't have any pain.
I don't have any pain.
Okay. Then at this point, I will want to conclude that I did the full assessment, and I don't have any concerns. Her eyes, her mouth, her nose. I feel like she has the tooth extraction has gone pretty well, and she has recovered. So at this point, I will go ahead and remove my gloves, and will perform hard hygiene and document that I have my assessment findings. Thank you.